Hello, welcome to the video. Thank you for being here. This is one of my journaling habits that I've been doing for some time. And my name is Dr. Prashanth and I am Muthukrishnan. I'm working at Albert Einstein College of Medicine, Bronx, New York City. And since I'm here in New York City and I'm experiencing one of the most challenging times on Mother Earth, I wanted to share my experiences with all of you and see if this may relate to your own life in your own respective ways. So I'm going to use the cheat sheet right here as I read through so that I can share my experiences more effectively. So I call it the New York coronavirus epidemic in the Bronx. Offense and defense during COVID-19 World War III. From March 16th, 2020 onwards, our university-affiliated hospital ICU, we had 20 beds, started getting COVID-19 patients in severe acute respiratory distress syndrome, ARDS it's called, acute kidney failure and shock. By March 25th, all 20 beds had ventilated patients. About 2 to 3 we are able to manually prone every day, sleeping on their tummy to help open up the lungs. And we are learning to strategize the division of scarce labor, overcoming the fear of getting infected. Our civilian patients, nurses, physicians, administrators, housekeepers, and assistants, they're gods in human form. We are providing help for nurses and physicians with multiple unstable patient events happening simultaneously. When the healthcare soldiers are stressed and thirsty and mentally exhausted, and the experience of serving these patients becomes painful, compromised, and ineffective sometimes. We were never trained to fight a world war. A good balance to the offense and the defense section of the army, we know, is what helps us fight the war. Even if not win the war, just fight the war till the end. Nurses, doctors, and assistant staff are the soldiers, and the virus particles we think are the opponents. And I will have, in some of my other videos, I will try to form analogies of this virus particle to other things that are happening in our daily life and see how that can relate to the general public, and we can improve during this challenge to become better citizens and better human beings. So the virus particles are opponents. The civilians that fight alongside our soldiers during the war are analogous to our patients. I find at least 2 of my staff saying, don't worry, I'll just give this medication and then I'll go and eat. And then suddenly it's 3 p.m. and they still have not had their lunch. So there are such things that are happening that could potentially impact how we are fighting this war. So we need to be balanced, being self-protective, selfless, while serving for these patients if we want to fight till the end. And teachings from various holy scriptures, the World War strategies, these are all described further in this article, and I try to make analogies. The battlefield. Our entire hospital is now becoming like a mega ICU, and we have new emergency construction plans. As of March, we have adequate N95 masks for our staff members. Not all our patient rooms are under negative pressure. We are receiving 3 to 4 non-COVID critically ill ICU patients per day, such as TB, seizures, sickle cell problem, diabetes flare-ups with other medical problems from all over New York City to help unload ICUs in Queens, Brooklyn, etc. We are open to admissions from all over NYC, besides the ICU and the PACU or anesthesia care or ventilated patients. We have had 10 to 15 new moderate and mild ARDS cases for COVID patients on oxygen nasal cannula every day on the general floors, and some of them end up getting home. Some of them get worse and come to the ICU and get on the ventilator. We just liberated a first patient on March 27th. He was still very weak from the illness. He's getting physical therapy. He got discharged recently. So yes, it means that we are able to save some of these patients, and we just have to figure out what is that makes them survive this, so that we can repeat them. From March 27th, we started losing 1 or 2 COVID patients every day so far, up and down, possibly from the rapidity of the disease and multiple other factors. We are balancing between quality of care for current patients versus accepting more patients from other ERs because we have scarce manpower. We're trying to make it as much as possible. CVVH dialysis staffing, delays due to negative pressure rooms, dialysis capable rooms, device malfunctions, exhausted staff. These are things that we are improving every day, and we are getting stronger through this. Handling COVID-19 suspects, patients, and non-COVID patients at the same time in the same location is actually a big challenge, and we're doing as much as we can to make the process more repeatable, more efficient. And we had a couple of patients started for our IL-6 research in the first few weeks of March, and then we are getting a few more. We have 2 ICU physicians trying to handle 20 unstable patients. One receives phone calls, triages patients from the command center while taking care of 8 patients, and the other one, the overflow unit also. Sometimes we help the PACU patients, the anesthesiologists there, and surgical critical care people have been amazing support for us. And the entire fraternity has come together in this, and that's something that we need to really build on, right? And then the other physician handles the other 12 ICU patients. So during the night shift, we have 1 critical care physician covering 20 patients, and then we have also had other physicians on call coming and supporting, and the new anesthesiology COVID unit. We are actively recruiting and trying to keep rotating positions so that there is no burnout. So we have about 5 to 6 nurses per shift, 2 respiratory therapists, and 2 assistants for 20 patients in the ICU, and then the other parts of the hospital also trying to repeat the same pattern. So that's the logistics so far, a brief logistic view, just to help you get a sense of what does it feel like in the battlefield. So, and I compare this to World War. We were always worried about World War III, and we were thinking that it's going to be a clash between countries based on their ego for capitalistic gains. But now this seems like it's a war between mankind and a common opponent, and that we call as the virus. But then maybe there are other analogies to it, like we are all fighting towards a common cause, and maybe we are fighting against stress, or maybe we are fighting against disrespect to human biology, or we are fighting against disrespect to Mother Nature, or disrespect towards characteristic traits that we as humans are executing, our actions. There are many analogies that we can use, but to be simple, we will start with what's happening in the battlefield. So when healthcare soldiers and civilians are advised consistently on how to and when to execute their forward offense moves and defense during this war, then we'll be able to fight till end. And if each one of us practiced personal protective safety and other defense measures in balance with the offense activities, such as giving medications, trying to kill the virus, entering the patient room to be able to help the patient, securing the airway, the ventilator while doing life-saving procedures, or when the public leave their homes for essential needs and services, then we will preserve our soldiers and civilians one by one in the next 2 weeks. And each one of us has to do it in our own perspective so that others follow by examples. The viable opponent secretly seems to be like installing landmine bombs in the civilian population that could later infect, explode, and kill more healthcare soldiers because the virus is all over, right? And these virus particles could infect more healthcare soldiers now who are trying to save civilians. So we're losing potentially a little bit of both. And this explosive cascade of spreading the disease can be further magnified if our healthcare soldiers are actually infected and when they go back into the community every day afterward. This is a concern, right? So therefore we have to understand these concerns and address them effectively from the viewpoint of intelligence, and only with an eye towards respecting the duties of the healthcare workers and protecting our public. There is no role for justifications here. There is no role for ego or yeah, justifications. We have to respond. We have to act on such concerns when they come up from public, rather than react, which is what we are trying to do. We are trying to balance action versus reaction. So anything that comes as a concern from the public towards the healthcare workers, I highly encourage that we pause right there and analyze the question, use our intellect rather than our emotional quotient, EQ. Right? We need to use IQ, intellect, rather than the mind to answer these questions, because every word, every action that we as soldiers address and the public is going to spread, right? And every positive video that can be passed on is going to multiply in action all over the globe. And this is one of the things that we need to be doing. Numerical facts from China, Wang and group from JAMA publication suggests that 41% of their 138 cases reported in February were actually hospital acquired. Because at that time, although China seems like they were doing a reasonable job of personal protection, they acted as fast as they could. Despite this, it seems like the virus infects people very fast. So 40 of the 138 were healthcare workers, right? So the same study suggests that one per patient could infect about 10 healthcare soldiers. And therefore, there are two things. Number one, being infected is one thing, and then the next one is being infected and becoming really sick is another thing. So those are the two steps in the offense-defense ratio, which is you can get infected even if you don't wear your PPEs. But even if you wear your PPEs, you can get infected. But that's not the end of the story, right? You have something called your innate immunity, your inherent defense mechanism that lies inside your body. And that is actually the strongest defense, much stronger than the PPE. The mental defense and the impact of the physical strength is super important, and I will be talking about those also in some of the videos. So the emotional attachment to the civil human lives interrupted us many times as I was executing my duties. And I'm learning every day from this experience, because I am attached to the outcomes of this disease, because it's a brand new disease and I'm not able to expect anything. So the emotional attachment to the civilian lives has interrupted us many times while we were caring for these patients as they passed, and we overcame that only because of the positive inspiration from our colleagues. So let's talk about how to focus on defense and when to implement offense forward moves. And the take-home message is for our healthcare soldiers to keep reminding themselves about defense-offense ratio every time they do something. This constant analysis using the intelligence is much more important than using the mental, emotional reaction to any time where there is a need for action. Sometimes there is no need for an action, and sometimes omission can be the action rather than committing. Okay, so I think we can stop with this in this video, and I will continue on to the defense and the offense details in the subsequent videos. So I would like you to now focus on your own duties back at home or wherever you are. Go ahead, carry on with your duties, and I'll see you at a later time when you have a few minutes available during your spare time. allocate some time for your own journaling where you can write down your thoughts during this epidemic and see if that helps you grow during this epidemic. Okay, thank you again for being here with me.